was originally a Floridian. Always wanted to do medicine. I went to the University of Maryland for undergrad, kind of traveled around, went to Oklahoma for medical school, and then did my training in New Orleans, where my husband had matched for residency. I did a pediatric residency there and then neonatology fellowship. I joined this practice straight out of fellowship in 2011. So I have been with this group for the past 9 years, and where I've started my career, and it's I developed it from there.
Can you talk a little bit about how you got into medicine, if you were at all inspired by a woman to enter the field?
I guess I was indirectly. I have no idea where my initial desire to go into medicine came from, because it, according to my mom, came out of the blue when I was 4. There's nobody in my family remotely in medicine. There's a lot of farming and teaching in my family. And according to my mom, when I was 5 and in first grade, I was told to do a book report on a career. I asked for a book on being a doctor, was handed a book on being a nurse, and handed it back and told them I would be the doctor and they could be the nurse. So it kind of has, I never wavered from that. Like I said, I don't know where it came from, but certainly never faltered from it. I do have a lot of strong, influential women in my life. My grandmother, who's currently 96, has always kind of been a force to reckon with. She got her pilot's license when she was in her 20s, so during the Second World War, at a time when women really weren't pilots. And I was just kind of always taught that women can be very strong and that can do the same things as men can do, and was always taught that I can do whatever I want. My dad always taught me to shoot for the moon, said even if you land, you miss among the stars. So I think, while not a specific woman inspired me to go into medicine, certainly those women role models, I said my grandmother, but my mother and my aunts all as well, kind of run their families, and was always taught that's what it is to be a woman, that there's no reason to do anything different or less than what you want to do because of it.
What do you think it means to be a woman in healthcare today?
So that's a hard question. I mean, healthcare has changed a lot, even in the time that I've been in medicine. The roles of women have changed a lot in healthcare. And I think the roles of women have been a part of some of that change, and in some ways still kind of held back throughout that change. I mean, traditionally it was, when I was 5 and said I wanted to be a physician, the expectation was if I wanted to go into healthcare, I should go into nursing because I was female. It's sad that sometimes that still kind of holds true, even with all the progress that we've made. I'm much more likely than my male partners to go into a room and later hear that somebody thinks the doctor has never been there because it was me, and they thought I was the nurse. So it's interesting because the roles have shifted and it's become a lot more, but in some ways I think being a woman contributes to that, because it where medicine has gone from this kind of hierarchy where it was traditionally a male physician that kind of was the head of the team and kind of dictated what was done. It's a much more collaborative process now with everybody that's taking care of a patient, and those roles have kind of shifted. So women are nurturers and caregivers, and that has kind of evolved to be a whole part of the healthcare team. And I think having women as physicians contributes to that.
This kind of blends into the previous question, but any more on any of the challenges that you experience as a woman in medicine?
Yeah, I would say the biggest just being, there are still some gender kind of differences in traditionally what types of practice females tend to kind of lean towards. And I think that comes with just some of the general personality differences sometimes between women and men. Like I said, I am much more likely to be mistaken for not a physician. That purely is because of my gender sometimes. There unfortunately is still the issue of, on a whole, women being paid differently than their male counterparts. So I think those are kind of the biggest challenges. And then also, throughout all of my training, 10 years of training, it's you're rewarded in training for being assertive and kind of being sure of yourself. And sometimes some of those kind of characteristics as a female are taken differently than if the same kind of comments or situations occur with a male. The perceptions can be different if it's coming from a female. So I find those to be kind of the biggest challenges.
What are some of the positives that come from being a woman in medicine?
I mean, I think the nurturing and caregiving part of it, I certainly, approach things in a different way than even my partners who are males. I mean, I am in a world that deals with babies and small children and moms, and being a mom, I think, gives me a different perspective on how to approach that as well. While I didn't have a preemie baby, it certainly gives me a different respect for what a mom may be going through, having had my own children. And I think as a woman, that gives you a lot to contribute to that experience as well.
What advice do you have for women who may be applying to medical school or entering the field for the first time?
I would say recognize that as a woman, you should expect that you can do the same things that anybody else can. I think it's still difficult. There still are going to be challenges. There still are things that you're going to face. But I would take my dad's advice to shoot for the moon and know that, there may be challenges that you're facing that are different than what your male counterparts are facing, but to stay true to yourself and always know that you can keep doing what you're doing. I think it's important for women in general. I would hope to see our society change to where we see each other as individuals. I want to be recognized for the things that I'm contributing, not because I'm a woman, because I'm an individual. And I think, that's something that hopefully will change. It's something we've seen a lot with all of the racial tensions happening currently. And some of the kind of underlying currents are the same there. So it's important that we recognize each other as individuals. So I think it's important for any woman going into any field, really, to recognize herself for her own strengths and contributions and never apologize for those.
How do you think women physicians can best support fellow women physicians?
I think it's important that we support each other by forgiving each other and giving each other some grace. Sometimes there's this perception that because we are women, we should have similar opinions or we should think a certain way, and that should be different than what our male counterparts think. And again, going back to what I kind of said previously, we're all individuals, and we all have different strengths and weaknesses, and I think we need to celebrate those and recognize those in each other, and recognize that sometimes we get so caught up in our own struggles and daily lives that we forget that everybody else has their own as well, and they may be different than ours. So I think as women, it's important. Women can sometimes be very nasty to each other, sometimes when we need to be and sometimes when we don't. And I think it's important that we recognize that we are all different, and we do need to recognize each other's strengths, and like I said, give each other kind of the benefit of the doubt and allow ourselves some grace.
Is there anything else you'd like to add or touch on that we may not have covered?
I don't want recognition for anything that I do because I'm a woman. I want it to be no different than any of my other male counterparts. I would hope that we can get to a point in our society where we're recognized for our individual strengths and celebrated because of what we have to offer as human beings.